Mostly, I wanted to stress to you that fertility preservation exists for men who are post-pubescent, so we can bank sperm. It exists for girls and women who are pre and post-pubescent in the form of ovarian tissue and egg harvest, and that those processes involve a number of specialists and a number of personal considerations, and sometimes, unfortunately, personal resources. And to hear more about that, we're very, very lucky to have Mr. Marc-keys and Ms. Shirlanna station here with us, who've been through this and are willing to share their amazing perspectives and their decisions around pursuing fertility preservation before pursuing cure for sickle cell disease. Thanks. And I think Ms. Station was going to go first.
Hi, good morning, everyone. Is everyone able to hear me okay? Okay, great. So personally speaking, as you guys know from my introduction, I've received curative therapies for sickle cell disease and the stem cell transplant process. In particular, as Lydia spoke on, this process involves the alkaline agents, the chemotherapy, and the radiation. So my experience was, before I entered that phase, I wanted to embark on trying to preserve my eggs for my future and the possibility and options of becoming a mother and parent later on in life. With considering that, you know, my quality of life would be improving, seeing that I was going through the stem cell transplant. So to begin with, like Lydia spoke with, said, you're assessed. So you're given a regular physical female exam, and you're monitored and looked at to see how is everything going on internally. After that initial assessment, then you begin to say, okay, well, working with the care provider to receive these hormone therapies, the different injections. My experience with the hormonal injections were nothing that was really kind of out of the way. I experienced the normal things that I think a person would experience receiving an extra amount of hormones. You know, you're hungry, you're tired. I did experience some minor bloating in the stomach area as the eggs were beginning to mature. Nothing really out of the way as well. And this was over between a 7 to 14-day period. And I was also being examined throughout this process as the eggs were maturing. So receiving the injections with the care provider, getting into these appointments, you know, experiencing all of this within a 2-week period. Then once they were finally mature, you have the actual removal of the eggs. And it's just a simple anesthesia procedure that a normal patient would have receiving a colonoscopy, is what I could compare it to, although you're not cleansing your system required for the colonoscopy. So after the eggs are removed, then they are assessed based upon grade. So I was able to bank 13 grade A and B eggs. And so they have been stored in the freezer, and I have the option to use those at any given point in time, whichever way I see fit. So if I myself want to carry any of those eggs, if I want to pursue someone else carrying those eggs, all of those options are available to me to be able to become a mother and a parent, given the fact that I've gone through this transplant and my quality of life has significantly improved. So I think that making this standard across the board is something that every woman and man should have, you know, should be available to receive. We are going through curative therapies, we're bold, we're warriors, and we're trying to improve our life. So we want to say, okay, what are my options? And this particular fertility banking is a way of having insurance. So I will let Marc-keys speak on his experience now.
Thanks.
Hello, can everyone hear me?
Yes, you're great. Sound great.
Hi, thank you. And just thank you for having me. I would like to touch up on sickle cell patients and actually thinking about uh, families in the future. I know for myself, just from my condition, I didn't think I would ever be able to have children just because I couldn't keep up with them. I was in constant pain. So uh, now there being a cure, you being able to live a full life, I feel like every patient should look into banking or preserving their eggs, just anything that you can. Having a family is a wonderful thing. I have a 1-year-old, and I love the time that I can spend with him. Every day is amazing. Me and my wife decided to look into banking because we always wanted children together. Um, we looked into it shortly, a little bit before my transplant date. The banking company, we called them, told them, hey, we wanted to preserve, X amount of vials. You can choose how many vials you would like to preserve. Each vial is about one child. So we told them X amount we would like to preserve. They mail you a kit. You put your sample in the kit and just send it back. It's pretty simple from the mail's perspective. But I definitely would like to let every sickle cell patient know that it's a beautiful thing to be able to have your child and not be in that constant pain all the time, just to be able to do simple things, go to the park or, go swimming. You should definitely look into preserving. It's extremely important.
Thank you both for providing that beautiful overview of your decision.